are going to study and to review all the anatomy. Vascular is very important. Vascular is something that all sonographers in the hospital need to make some vascular. Maybe you are not a vascular technician, but even you are not a vascular technician, you need to do in venous and carotids. There are a lot of information in this course, is something that I need you. The first, the main component of the human cardiovascular system are very easy, only three things: the heart, the blood, and the blood vessels. This is the three components of the cardiovascular system. Heart. We have the class of review. You remember that the muscular cone-shaped hollow organ about the size of a clenched fist. Remember, when the heart is big is when the heart is sick. The good heart is little. The big heart is because have a disease. The most common disease is heart failure or congestive heart failure. I explained you that the congestive heart failure is the disease that the people have swelling of the legs. It's a very common disease, and even you are working as general sonographer, it's very important to know. Why? Because you cannot put horizontal person that have heart failure, because the person begins suffering for dyspnea. Dyspnea is the person cannot breathe because water enters in the lungs. It's very important, the heart, for echocardiography. Remember that this course is the introduction to echo and vascular, and this is for that. In the anatomic review, I am going to make an anatomic review of the cardiovascular system, heart and vessel. Blood, no, because blood has no anatomy. In blood, we only are going to talking little about some physiological aspect, but in the blood, we have no anatomy. It's a fluid that pump blood through the body and beat normally about 70 times per minute. When you see that I take the heart beating of a newborn, how much it is the heart beating of a newborn? 150. For us, this is tachycardia, but this is not tachycardia for a fetus. For a fetus, normally is 140 beats in 1 minute. They have more, and even when you have little children, you have more. The frequency of a normal 3 or 5 year child is about 100. When you are adult, you have 70 times per minute by coordinate nerve impulse and muscular contraction. We know that the heart and the cells of the heart, that the two function, working as a nerve and working also as muscle. Nerve because transmit the impulse, muscle because contract. Enclosed in the pericardium, we know what is the pericardium. What is the pericardium? The pericardium is a serous membrane, and the serous membrane are always the same. Two membranes, one is called parietal, the other is called visceral, and the two have in the middle a cavity. The three most important examples, but not the only, of serosas are the pleura that cover the lung, the pericardium that cover the heart, and the most important for us, peritoneum that cover the organs that are in the abdominal cavity. But in this case, we are talking about the pericardium. Remember that the pericardium have the visceral, but at the visceral have other name. They call also epicardium. The membranous sac filled with serum fluid that enclose the heart and the root of the aorta and other large vessels. You can see here the pericardium. There are important diseases that is called pericarditis, but pericarditis is not the inflammation of the pericardium. Pericarditis is that the pericardium cavity filled with fluid and the heart cannot beat normally. This is a disease that is very easy to recognize with echocardiography. Remember that fluid in ultrasound is anechoic. When you find something anechoic around the heart, you can have the suspicion the person suffers from pericarditis. This is the pericardium is composed of two layers separated by a space called the pericardial cavity. In the middle, between the visceral and the parietal layer are the pericardial cavity. The outer layer is the parietal pericardium and the inner layer is the visceral pericardium. Remember, all the serosas are the same. Pleuras also have a parietal pleura and a visceral pleura. Peritoneum also have the same. Always there are a potential cavity. This is something that is empty, but when the person is sick, become filled with fluid. In the case of the heart, pericarditis. In the case of the pleura, pleural effusion. And in the case of the peritoneum, is called ascites. And of course, ascites is the most important for us. You have here this picture that you remember: visceral pericardium, parietal pericardium, and the pericardial cavity between both. The parietal pericardium forms a strong protective sac, and you can see here the pericardium. This is a review. I am not going to make too emphasis in this because it's not, I have no time to finish today. Okay, pericardium. This is the same epicardium. The visceral pericardium is also known as epicardium. It's very important. If you read something, you cannot recognize what is the epicardium. The epicardium is the visceral serosa of the heart. Epicardium. What they call epicardium because it's very hard to separate from the muscle. You have here all the time the same picture, and look in this, the parietal pericardium become visceral pericardium. Is the same membrane. It's not different. Only when it's covering outside is parietal. When it's covering inside is called visceral. It's the same membrane. This is explanation that I give you how is the idea. The pericardium is you have something round and you put inside the heart and it's covering by the visceral pericardium and parietal pericardium. Where is located heart? In the thorax, but in what part of the thorax? In what part that is called the mediastinum. You remember that the mediastinum has 4 areas. The area where is the heart is the middle area of the mediastinum. Between the lungs, behind and slide to the left of your breastbone, sternum, above the diaphragm muscle, and below the great vessels that are in the superior mediastinum. Remember, the mediastinum have 4 areas: superior, anterior, middle, and posterior. Anterior to descending aorta, bronchi, and esophagus. The organ is about 12 centimeters long, 8 centimeters wide, and its broadest part and 6 centimeters thick. It's little. The heart is not big. When the heart is big, the person have a dilated cardiomyopathy. In other words, the cavity of the heart are bigger or the muscle is bigger, but normally a good heart is little, it's not big. The heart weighs between 7 and 50 ounces. This is something. And the layers of the heart are 3. The epicardium, the myocardium, and the endocardium. But remember that this epicardium is the visceral serosa or the visceral pericardium. Epicardium is the visceral pericardium. Epicardium describes the outer layer of the heart tissue. Myocardium. Myocardium is very important because the cells of the myocardium are muscular, are striated, but have some difference with the cell of the muscle of the body. Are the most important, are involuntary. You cannot change your heart conscience. This is something that you cannot do with the heart. Are involuntary. Striated muscle, involuntary in the wall and histological foundation of the heart. You know that this cell has something. Hello? What is your name? And what is your class? Let me see. What? No, patient care, no yet. Okay, it's other place. Okay. They are nerve, they working like nerve, and they working also like muscular cells. It's a combination of the both. The endocardium is the inner part, and it's a continuation of something that in the vessel is very important. Endothelium. Endothelium. The endocardium and the endothelium is the same. What is the endothelium? The inner layer of arteries and the inner layer of vein. And in this moment, endocardium is a continuation. It's a very soft layer to do not produce clotting of the blood. The endocardium is the innermost layer of tissue that line the chambers of the heart. Its cells are similar to endothelial cells that line the blood vessel, are the same, are very flat, are a continuation. What kind of tissue is a epithelium? Remember, epithelium are the tissue that cover any organs. Peritoneum is epithelium, pleura is epithelium, but endothelium also is a epithelium because it's a tissue that covers other organs. The chamber includes 2 ventricles and 2 atria with muscular wall. This is something that is only a review, and not to make too much emphasis is suppose this is the septum. Separate the right cavities from the left cavities. This is very important to understand that the heart of the fetus working totally different than the heart of the adult. When the person born, everything changes in the cardiovascular system. First, because there are communication between the 2 atrium that is called oval fossa. This is something that not happen in the adults. This is the septum, the most common congenital defect of the heart is communication between the ventricles. But a lot of people resolve the problem alone. Nobody knows, born with the problem, but little by little the problem was resolved. The most common cardiopathy, congenital cardiopathy, is the communication in the interventricular. In general, are very, very little. Some people come in adult, and in the adult no have the problem. Yes?
What is the soplus en el
No, murmur. Murmur is the, in Spanish is called soplo, in English is called murmur. What is the principal cause of the murmur? There are many. The first more important cause of the murmur is physiological. The woman that is pregnant. When the woman is pregnant, needs to have more use of the blood, and that produces a normal murmur in the aorta. But there are other murmurs that are not as big problems. And there are others that, yes, there are a lot of murmurs, depending if there are a stenosis that produce, or if there are insufficiency that let that the blood coming in the contrary direction. This is very hard for doctor in general to looking with the stethoscope what is the kind of murmur, but there are not only one murmur, there are a lot of murmur. Also, there are murmur in the carotid. If you have a stenosis that I know everybody knows is the narrow of the artery, you put the stethoscope, you can hear murmur. Murmur is a sound in the audible frequency that was produced but a different cause. Of course, when there are interventricular communication, you can hear a murmur. The right side resides, this is very important, the right side deoxygenated blood. Right side deoxygenated blood. Remember, artery is not because have oxygenated blood. Artery is because the blood flow from the heart outside. Veins is because the flow go to the heart, but do not depending on the quantity of oxygen. Example, pulmonary artery is an artery and have no oxygenated blood. Other example are pulmonary veins. Pulmonary veins are veins but have oxygenated blood. The left side of the heart pumps oxygenated blood into the aorta, and to all parts of the body. This is a typical echocardiography. This is the left atrium, mitral valve, left ventricle. I cannot see here the aorta, but it's a good picture of the left atrium and the left ventricle. This is the most important picture in echocardiography. It's called long axis. It's one position that you could be heard in the long axis. It's the most common. This is something that we are going to see and practice with my friend Acosta, that is the only person that had no big breast here.
No, man.
Not me. The valves of the heart include the tricuspid valve, that you know is in the right side, the bicuspid valve that have other name, how is called mitral valve, the semilunar aortic valve, and the semilunar pulmonary valve. You can see here left atrium, left ventricle, and this is the aorta here. This is the picture of this. Remember that the orientation in the heart is different, that in the heart the orientation mark is in the other side. It's not exactly like the orientation that I give you in ultrasound. They have some orientation changes. This is not general. This is not nothing that anterior, posterior, superior is not for the heart. Heart have a special orientation. Atrioventricular. You can see in this excellent picture the two atrioventricular and the two semilunar valves. Remember, it's one atrioventricular valve is open, the other atrioventricular valve is open too. And if the atrioventricular valve is open, the semilunar valve is closed. They work in the contrary, semilunar and atrioventricular. Two heart valves through which blood flow from the atria to the ventricles. What is the most important? Mitral, because always in the heart, left side is more important than right side. That not mean that there are no disease of the right side. The most important disease of the contrary are in the left side. Two valves, one located at the opening of the aorta, another at the opening of the pulmonary artery, each consisting of three crescent-shaped cups. You know what is a crescent? It's like a half moon. This is the word crescent in English. If you see this valve, everybody knows what is systole. I don't want to make more emphasis in systole. Systole is the contraction of the heart. Diastole is the contrary, when the heart refills. And always systole, diastole, systole, diastole. But even the heart is big, and you know it is same, but the valves are little, and this is that impressed me. Okay, I see the heart is working on the life, but the valves, the pulmonary valve is like this, and you are alive because this little thing is working. Okay, no emphasis, this is not the same idea, this is a review. Was supposed we make this graphic. You have this graphic, this is something that you need to know, all this graphic, but not for today. This is not nothing that we can finish today. This is only a review. What is this very important part? What is the name of this? SA node, sinoatrial node. This is called the pacemaker of the heart. It's where the impulse beginning. What is the disease? The disease of the people that have problems are called arrhythmias. Sometimes are tachycardias, sometimes are bradycardias, and sometimes are very, very disordered beating that are not tachy or brady. This is very arrhythmias in general are in the sinoatrial node or in the communication part of the impulse. Remember, it's not the same the impulse and the contraction. The impulse is that say the contract, but the contraction is after the impulse. Sinoatrial node. After the sinoatrial node, there are the communication line, and this is the Purkinje line. Okay, you have other picture here with the sinoatrial, atrioventricular node, and the Purkinje. Enough. We are not going to make emphasis in this other thing. I am not to make emphasis in echo or cardio. We are going to make more emphasis in vascular. Echo is something beautiful. I love echo, but the examination for echo is very, very hard. The examination for vascular is similar to the examination for abdomen. For the examination for echo is prepared for people that have 3 or 4 years scanning. In other words, a lot of questions that are not in books, a lot of questions that are the experience that you have as sonographer. And this is for that. Don't suppose you can go to echo before passing abdomen. It's not good deal. It's better to focus first in abdomen, OB, and after you are a sonographer, go to vascular or go to echo. Don't enter for echo directly.
¿Qué pasó? Están llamando para la silla, para la mesa.
No, está llamando para mí.
Sí,
No, yo pedí la mía, pero...
Pero ahí están grabando la clase que están dando. ¿Tú puedes grabar?
Sí, yo también estoy grabando lo que qué bonito las de Okay. Okay, this is the typical contraction of the head. Look in the stimulus, sinoatrial node, atrioventricular node. There are a little delay here, and this is the impulse. Remember, P, QRS, and T. P is the stimulus of the atrium, QRS is the stimulus in the ventricles, and the letter T is called repolarization. Repolarization is when the electricity coming normally. P, QRS, and T. There are a lot of information in both of it. Atrium excitation, ventricle excitation, and repolarization. Blood. Okay, what is blood? Blood is a fluid filled with cells, but not only cells. Also have proteins, also have electrolyte. What is electrolyte? Sodium and chlorine. They have proteins, clotting proteins. When you cut, the blood automatically clots. This is called clotting. This is because the blood has something, and the most important of the blood that everybody knows, the red cells. This is cells that have hemoglobin and lead to put the oxygen from the lung to all the body. Blood is a specialized bodily fluid that delivers nutrients and oxygen to the cell and transport metabolic waste product away. You know that the blood also is called a tissue. Yes? Even in fluid, they call the blood a tissue.
Connective tissue.
See, yes, connective tissue. Exactly. It's composed of blood cells suspended in a liquid called blood plasma. Plasma constitutes 55% of blood fluid. It's 92% water and contains proteins, glucose, protein, glucose, mineral, iron, hormone, carbon dioxide, platel, and blood cell. There are a lot of things here, but this is not important for us. It's only a review. We are more to talking about the hemodynamical or the physics of the fluid moving, but the content of the red cells, and this is not important for us. Serum albumin. Albumin is a protein inside the blood. This albumin inside the blood is very important because it's that they take the fluid inside. Other time, if the person has no albumin, the person produces edema, but edema as big that is called anasarca. That means all the person is swelling because the serum albumin is fundamental to the life. It's the concentration that produces the osmotic pressure to get the fluid inside the vessel. Albumin, yes. Clotting factor are other proteins. You know, people with clotting factor. This is important for sonographer to understand clotting factor because sometimes you are going to help the doctor to make a paracentesis or a thoracentesis, but if the clotting factor are not working good in other time, if the clotting time is not normal, you cannot make the procedure and you call the doctor. Doctor is not possible. In other words, you read the papers and you need to know the normal range of the clotting factor. Remember, ultrasound is not only to scanning. Ultrasound have more than scanning. You need to know the normal. Sounds good. Americans that are very intelligent and are more intelligent when I'm working, they put the normal values. You know when something is wrong, but when I study medicine, they don't put the normal range. You need to remember. Here is very easy, but you need to review the clotting factor, because if the doctor begins and there are problems with the clotting, it's your responsibility.
So what is the range?
Depends. There are PT, PTT. In this moment, I don't remember. There are different examinations, and the clotting is very complex to use in this moment to explain. It's something that needs only one class, and the exactly time I don't remember of the PT and PTT. I can review for you if you are interested. Okay, we finish with the head. We finish. We're going to the part more important. Vessels, arteries, veins, and arteries, vein, and between the artery and vein, what there are? Capillaries. Okay. The blood vessels are the part of the circulatory system that transport blood through the body. This is the concept of the blood vessel. There are three major type of blood vessels: the arteries, the capillaries, and the veins. This is the three, and we use ultrasound for the arteries, we use ultrasound for the vein, but we don't use ultrasound for the capillaries because capillaries are microscopic. And remember, ultrasound is not microscopic. Something when it's very little, you cannot see with ultrasound. And that depends on the size of the arteries. You have the coronary arteries that are very important arteries, but ultrasound is not good because the coronary arteries are too little to see with ultrasound. The arteries which carry the blood away from the heart are called arteries. Do not depend on the oxygen. The artery wall consists of three layers. Very important. You must remember the three layers of the vessel. This is the same for arteries and this is the same for veins. Three layers. The first is the tunica intima. The tunica intima is the endothelium. The endothelium is the tunica intima.
That's the first.
That's the first. In the middle you have the tunica media. The tunica media is muscular. It's that the produce the hypertension. Is something that contracts. It's a small muscle. And the outer tunica is the tunica adventitia. Is collagen. It's a very fibrous to protect the muscular inside. Three layers. The artery and the veins.
What's the last one?
The last one was the adventitia, very fibrous, collagen, very hard, that protect all the vessels.
And
Tunica,
I'm sorry.
Yeah.
And for the vein is called the same?
the same, but the side is not the same. Have the three same, but it's different. In the artery you have bigger muscular, in the vein you have no.
It's
No
more
what?
pressure.
Yeah, it's not pressure. Okay, I have new student, but I have no one of the new students. Tunica adventitia, the strong outer covering of arteries and veins. This is the adventitia, is the outer layer of the vessel. Same for arteries, same for veins, but not for capillaries. Capillaries have no three. Capillaries have only one. Endothelium is the only layer that have capillaries. Tunica media is composed of smooth muscle and elastic fibers. This layer is thicker in artery than vein. Very important. Tunica media is different in the arteries, and this is for that the problem of people with high pressure. The muscular is so contract that the person have a blood pressure higher than normally, and the drugs to fight against hypertension working directly in the small muscle, relax the small muscle of the hypertension. It's not the only drug for hypertension, but it's one of the most important drugs of hypertension. The tunica intima is the endothelium, it's not different, it's the endothelium. Tunica intima is the inner layer of the arteries and veins. It's very, very soft. Why? Because it's not producing clotting or plaques or anything. Endothelium is very, very soft to do not produce any problem. 3 layers, please, very important, it's not nothing to forget. 3 layers in the arteries, 3 layers in the veins. The capillaries, the part most important because this is the part where there are the interchange. What things you interchange here?
The oxygenated blood for
Oxygen and nutrients, electrolytes, anything, white cells that enter and go away to protect the body. The capillaries which enable the actual exchange of water and chemical between the blood and the tissues. Capillaries have a very thin wall comprised only of endothelial cells. In other, arteries have 3, veins have 3, but capillaries only have 1. But this is only information because in vascular ultrasound we do not scan capillaries. Are very little, not important in vascular ultrasound. Only to remember, the vein which carry blood from the capillaries back toward the heart. The structure of the vein is similar than to the arteries. 3 layers exactly: intima, media, and adventitia. 3 layers, but the difference is the muscular layer of the vein is not, and that means that for the vein is easy to dilate. And I asking something, with ultrasound, how you know something is artery or is vein?
Because when you push,
you push with the transducer and the vein coalesce. Coalescence means that the 2 walls go together. This is the easy difference between artery and vein. Tunica adventitia excited. This fiber allows the arteries and veins to stretch to prevent over expansion. Tunica media, this layer is a thinner in veins than in arteries. This is very important, and I don't know it's in the question, but this is very, very important. You must know that the difference between artery and vein depends on the thickening of the muscular wall.
Of the tunica.
And the tunica intima, the inner layer of the arteries and vein, is also called endothelium, and are exactly the same, no different. What is the function of the endothelium? Let the blood moving and do not produce a clotting process. Difference between arteries and veins. Arteries, this is very important, arteries are more muscular than veins. Veins are often closer to the skin. Yes, when you see 2 things, you are going to see always the vein is closer to the skin than arteries. Veins contain valves to help keep blood flowing toward the heart. Yes, with ultrasound sometimes you can see the valves. And there are some studies in venous to look in the direction of the blood. You know, with Doppler we can know what is the direction of the blood. If you know a valve, you know the blood must flow in one direction but not in the other. This is the 3 difference between arteries and veins. Anatomy. Okay, this is only review. There are 2 circulations, the pulmonary circulation and the systemic circulation. But ultrasound, vascular ultrasound is not good for pulmonary circulation. It's so inside, it's not easy. Sometimes you can take some Doppler in echo in the pulmonary artery, but it's all that you can do. And sometimes in echo you measure the pulmonary vein, but very little. It's not, and also it's not important because the disease that is stenosis is something that is not normal in the pulmonary circulation. Pulmonary circulation is the portion of the cardiovascular system which carry oxygenate the blood, in other words, deoxygenated blood from the heart and return oxygenated blood from the pulmonary veins. systemic circulation. El mío. Systemic circulation is the part of cardiovascular system which carry oxygenated blood away from the heart, return oxygenated blood. Miren, what beautiful. I put the clip here and you have a movie, but we have not too much time for this. Other day. Right and left main coronary arteries. What are the first arteries of the coronary artery? Can you see with ultrasound? Not as so little. The little arteries cannot see are important. Oh my God, I think are the most important arteries because all the diseases that the people have are problem in the coronary. Right and left, left from the left ventricle, right from the right ventricle. And look at what are here. 1, 2, 3. I'm talking about this. Not okay. Brachiocephalic trunk. I need you put something. Brachiocephalic trunk have other important name or not. Not name. Brachiocephalic trunk in a lot of books is called innominate artery. The artery that have no name. It's very good because if the only artery have no name, everybody remember. A lot of books talking about innominate artery. The brachiocephalic trunk is also called innominate artery. A large artery arising from the arc of the aorta and dividing the right subclavian artery and the right common carotid artery. Attention, because the left subclavian is directly from the aorta and the left common carotid artery also coming from the aorta, but not the right. The right coming from the brachiocephalic trunk, and always say 1, 2, 3. How is it? Remember, this is ascending aorta, transverse aorta, descending aorta, thoracic, because after this, enter in the diaphragm and change in abdominal aorta. The common carotid artery is the artery that supplies the head and the neck with oxygenated blood. Very important, very easy to scan. You put your transducer here near the sternocleidomastoidal muscle and very easy you can find at side of the thyroid gland the carotid and at this side the jugular. You put a little pressure, the jugular vein, the internal jugular vein closed, but the carotid or common carotid remain open. Remember, oxygenated blood. The internal carotid arteries are two major arteries on each side of the head. You can see here the bifurcation, the carotid. The bifurcation of carotid, the common carotid produce two arteries. One for the head and the face, other that go to the brain. And also we explained that the shape of the wave are really different because the internal carotid is a low resistance artery because the blood flow in the brain is always big, but in the muscle and bone of the heart the other is high resistance. It's different the shape, but this is for other class, even is a review. They arise from the common carotid artery where this bifurcate into the internal and external carotid artery and they supply the brain. You know that this is at the level of the cartilage, of the thyroid cartilage. At this same level you can find the bifurcation. I explained something that was not here, how will be the evaluation, we are more in the same system, with the famous chuleta. You can take your examination when you feel good. If you don't feel that the grade is good, you can retake the examination for second time. But you know, if your grade is worse, this is your risk. And at the final, I'm going to make an examination with all the questions. Everybody like this because you can adapt the examination. Some people take the examination very easy, others use more time. And only one protocol. The problem with protocol that I explained, everybody can show the neck, but not everybody wants to be scanned. But I am going to give you the class of arterial, I am giving you the class of veins. If you want scanning other person and the person wants scanning you, very good, I will help you, but I am not make mandatory protocol of the arteries of the leg because I don't know if you have the person that is going to let you scanning for you. But this is not excuse with carotid because it's everybody. But here we have no this problem. The external carotid artery begin at the level of the upper bone of the thyroid cartilage, where the common cartilage bifurcate. Always, in general, not always, the biggest one is the internal carotid artery. The little one is the external carotid artery. The bigger one that is internal is low resistance. The little one that is the external is high resistance. This class always is the same. We are going to make a practical day. I am going to give you hours. Yes, you know me. I have no problem. I am going to give you hours. One day theoretical, the other day practical.
What day? So
Yeah.
on Wednesday?
Yeah, I think Wednesday is good. It's a good idea. But I need to talk with other teacher about what is the good day for us. But this is very good because when this is practical, we go there and we take 4 hours every time that we come in. You need to see the arc of the aorta, the subclavian artery. What is the name subclavian? Because it's below the clavicle. Subclavian artery. You scanning? Yes, we scanning the subclavia. Some people with cancer have something inside to put drugs, and this sometimes become clotting, and you need with ultrasound to look if there are flow. How you know there are flow or not? With color Doppler. You put the color Doppler. If there are no color inside the vessel, you know flow is not there. The subclavian artery supply blood to the arm with some branch supplying the head and the thorax. What is the branch of the subclavian that go to the head? Is called vertebral artery. And the vertebral artery has something curious. Remember that the vertebra have a little hole, called transverse foramen, where pass the vertebral artery. The vertebral artery also go to the brain. This is this one that is here. This is the vertebral artery. Is a branch of the subclavian. This fifth branch that you have here is the inferior thyroid, but not important. The important is the subclavian. Vertebral arteries, you can see here, the vertebral arteries are major arteries of the neck. This is very interesting to scan in vertebral artery. You put your transducer, you move it toward the posterior part, and you see with color Doppler a discontinuous color, because when the artery is going through the vertebrae, do not produce color. And this is very easy to identify, but when you identify the vertebral artery, you are going to find a way that is very similar to the internal carotid, because it's low resistance. And this is the vertebral arteries that are in the neck. They branch from the subclavian arteries and merge to form the single midline basilar artery. The two vertebrae enter. What is the hole that we have in the occipital that enter? The foramen magnum. Exactly. The arteries enter from the same hole. The foramen magnum is the big hole in the occipital bone. Basilar arteries supply blood to the posterior part of the circle of Willis, and thus significant portion of the brain. In general, the blood of the basilar arteries are the posterior part of the brain. Remember, vision is in the occipital lobe, and when you have a problem of ischemia or problem in this artery, it's logical that you have problem in your vision. Even the A's are in the other areas. The circle of Willis, circulus arterius cerebri, is anastomotic. What is anastomosis? Everybody knows. It's the communication between two arteries that sit to the base of the brain. The circle of Willis formed when the internal carotid artery ICA enters in the cranial cavity, bilateral and dividing, anterior, posterior, blah, blah, blah. Not too much important for us. Why? Because we are made the practical area in the typical scanning that they are going to order you in the hospital. Only 3 carotids, venous of the lower limb and arterial of the lower limb. In this moment, I don't want to teach you to make transcranial. Why? Because even me don't know how to do it. And this is moment we are going to finish with the Willis polygon, everything, and go to the arteries that normally we are going to work. The anterior cerebral artery, the communicating artery. You know, this is a review about the anterior cerebral artery and the unit is the communicating artery. This is here only one. I don't need you remember everything about this. The posterior communicating artery are two posterior communicating artery, and this is the polygon of Willis. Not really the center of the course. It's only to remember. The right subclavian artery originates from the brachiocephalic trunk, but the left subclavian artery not. The left subclavian artery beginning directly from the aorta. Please, this is very important. This is not the thing that you go to one hospital and you are ignorant about this. It's not permissible. It's very, very important to remember these vessels here. Very, very basic. The axillary artery, okay, the subclavian finish and begin. You have no uniform.
Sorry.
Come on, take your. The axillary artery begins at the first rib and as direct continuation of the subclavian artery. In other moment, the subclavian artery begins axillary artery, where when the axillary go outside the thoracic cavity, in the rib begin axillary artery. Very easy to scan axillary artery, where in the axilla present. When you need to scan here, you remember artery at the lower border of the teres major muscles. There are muscles that you cannot see here. In this moment, the axillary artery becomes the brachial artery. This is something what the ultrasound you don't know exactly, but you know if you scan the axilla, it's axillary artery. You put the transducer in the arm between the bicipital and tricipital muscle. Inside the medial part, you are going to find in this border, you are going to find the brachial artery. Okay, this is in the axillary artery, looking what easy. Axillary artery more round and the axillary vein more oval. That is the same. When you put pressure, this is going to close, this is going to be round because have more pressure. Brachial artery originates at the lateral border of the teres major muscle. What is the famous teres? What means teres? Round. And teres is the muscle that let you doing this. This muscle that is here, rotator cuff, is the muscle that changed axillary to brachial. And of course, the other day I remember Laura, because Laura said, "What I need to study false positive, false negative." Oh my God, my wife is studying for vascular, is in the program. In the examination of vascular, asking you everything about false positive, false negative, predictive value. And I remember Laura. I say, I am going to tell you, my wife is crazy. I need to use like 1 hour to explain. Okay, course down anterior humerus, posterior to the bicipital aponeurosis. This is where is three things: the artery, the vein, and the nerve. Here is inside, between the biceps and the triceps. It's very easy. There are area here that is very easy to recognize how to scan it. But remember, arterial and venous of the upper limbs are very unusual. That not happen with the lower limb. Arterial and venous of the lower limb is a scanning of every day. A scanning of the upper limb is something that you're doing. Maybe I remember to doing arterial of the upper limb 5 or 6 times, and venous sometimes a little more. Nothing for free with my friend. Okay, I don't know if you are going to graduate of sonographer or model of sonography. Brachial artery has 3 main branches. The first branch is called profunda. The little branch that is called profunda. not very important. You cannot see too much. And that continuum is logical. What happened? When they come in here bifurcate, and in the other area have the same name of the bone. Radial, because it's in the side of the radial bone, and ulnar, because it's in the side of the ulnar bone. Brachial artery have three main branches. And you can see here the bifurcation here in the elbow, ulnar, that is medial, and radial, that is lateral. Radial is typical because the radial artery is when we take the pulse of the patient. Here, we can take the pulse of the patient in the radial artery.
Yeah, because I have tendinitis, so me ayuda me tengo para.
Radial artery is the main blood vessel with oxygenated blood of the lateral aspect of the forearm. Radial artery becomes the palmar arch, which join with the deep branch of the ulnar artery. This is a typical question in RDMS vascular because the ulnar artery is the other side, the main blood vessel with oxygenated blood of the medial aspect of the forearm. Exactly the same. This is the bifurcation. It's very easy. Okay, to remember. Brachiocephalic trunk, subclavian artery, axillary artery, brachial that make the profunda continuum, bifurcation, radial, ulnar, coming here, deep arc, superficial arc, and the digital arteries that go to the fingers. Digital arteries are not important for us, are very little, not generally scanning. You can scan it, but it's not nothing, no, it's something very rare. Okay, terminating the superficial palmar arch, which join with the superficial branch of the radial artery. Okay, the superficial palmar arch is formed predominantly by the ulnar artery. This is the typical, this is a tip, not important for me, but this is the things that I know that are in RDMS examination. And this is for that when you study for RDMS examination, you interchange questions with other students. It's very important in the internet. You're talking with other people that are going to take the same examination of you, and you change what are the typical questions that go. Is very, very good. The deep palmar artery arterial network found in the palm is usually formed mainly from terminal part of the radial artery. And this is the digital arteries that come in here. You know that there are a lot of blood here. When the person have problem, there are a lot of blood in the arm when there are accidents in the arm. Abdominal aorta, okay, other part of the review. Oh my God, I make emphasis in abdominal aorta. Of course, sonographers need to know perfectly the abdominal aorta is not too big. At the beginning of the level of the diaphragm, travel down posterior wall of the abdomen in front of the vertebral column. It runs parallel to the IVC. What means IVC? Inferior vena cava. And always in ultrasound, when I make the picture of the aorta, always I asking, where is the vertebral column? If you are looking the aorta, you need also to visualize the vertebral column. And together, vertebral column always is posterior to the abdominal aorta. Okay, we have the different arteries here. What is this? Celiac trunk. What is the name? The C-gall. What are the branch? Are three branch, but you can see only two. Hepatic artery and splenic artery. The next one is very easy to see in ultrasound. It's called superior mesenteric artery because have a hyperechoic round. The other very important are the two renal arteries, and after this coming something that you cannot see with ultrasound, gonadal. In the male are called testicular, in the female are called ovary arteries, and at the final, the inferior mesenteric artery and the bifurcation. Please, this is not for examination, this is for work. If you are working and the radiologists know you are ignorant about the abdominal aorta, I suppose and I justify that you will be fired. No one can be a sonographer and be ignorant about the abdominal aorta. Are not little vessels, are big, big vessels. Visceral arteries, celiac trunk, superior mesenteric artery. The middle suprarenal are not important for us. Renals, gonadal, and inferior mesenteric. The three important are celiac trunk, superior mesenteric artery, and renal arteries. This is the important ones. You can see the same other thing. I am not going to explain all, but looking the bifurcation left common iliac and right common iliac. Even only say here iliac artery. The name is common iliac artery. Okay, very easy picture. We are going to very easy picture. There are a lot of landmarks in this picture that we need to recognize. Very easy. I know you know. What is this? Tip of the liver. What is this? What is this little one? Exactly. And you can see the hyperechoic area here. What is this? Okay, this is very easy in the moment. What is this area that is here? And what is this area that is here? The pancreas. The pancreas. This is little, this area here between or near the celiac trunk and the superior mesenteric artery is the pancreas. Don't remember that the pancreas is an organ that is transversal. When you scan inside it, that you find a little, remember, to get a long axis of the pancreas, you need a scanning transverse. Okay, this is the pathology of the aorta. And aorta is something that is not very hard in ultrasound because there are only one important disease for the aorta. Important aneurysm of the aorta, very common in all people. When you see the doctor order you examination of aorta in a 34, 33 years old person, you know you are not going to find nothing. In general, it's a disease of all people. And you can see here the ultrasound. This is clotting, this is plaque, and you can see the dilatation of the abdominal aorta. Very, very common disease. Ultrasound is very good to make following. If the aneurysm has more than 6 centimeters, the patient cannot go home. They need to sign something to let you go. In general, the patient will go. They know you are scanning the aorta. It's different than other pathologies. The patient knows the disease, and of course, he is going to ask you, don't say nothing. Only it has more than 6 centimeters, you call the doctor and you give the information to the patient that must remain in the hospital. Okay, this is abdominal aorta here. You can see here the mixture. I don't know. I come in here.